My name is Ivy and I'm a Purdue Northwest nursing student, and I'm going to demonstrate how to properly insert a male Foley catheter. Before I begin, I will check my patient's chart and see the order for the Foley catheter, look for any contact precautions, and put on whatever PPE I would need. I would then gather all of my supplies, which I have here, my wash basin, my clean gloves, my hand sanitizer, and then of course my Foley kit. I will then walk into my patient's room and perform hand hygiene while doing so the patient can see that I am sanitizing my hands. Hello, Mr. Jones. My name is Ivy. I'm a Purdue Northwest nursing student. I'm going to be inserting your Foley catheter today. Can I see your ID band, please? Thank you. Can you verify your full name and birthday for me? Awesome. So then I will ensure that my patient's room is closed and the curtains are closed and there are no unwanted visitors in there, and then of course adequate lighting as needed. I will then don my clean gloves and let Mr. Jones know that this is going to be a little bit of an uncomfortable procedure, but I am going to do my best to make it as painless and fast as possible. After I've donned my clean gloves, I'm going to get my wash basin with my wash rag and then raise my bed to a comfortable working height so I'm not leaning over the patient. And then after my bed is at proper working level, I'm also going to lower the side rail just so I have more room to work. There we go. I am going to take out my towel and my warm water and make a mitt. I am then going to wash the penis in circular strokes, washing the tip first, and then swishing sides, and then down the shaft. Using a new side of the washcloth each time, just so you don't spread any unwanted bacteria. All right, I would also wash the scrotum as well, just to ensure cleanliness. After it is washed, I will then pat dry with the towel. After the penis is dry, I will then discard my clean gloves, re-sanitize, and then get ready to begin my sterile procedure. So to start, my patient, I would place their legs a little bit apart. Hopefully in a situation like this we would have a compliant patient, so I would be able to open my kit on my bed. It is a little bit easier with female patients because they're in the dorsal recumbent position, but for the sake of this, our patient has no legs, so I can just do it here. When grabbing the Foley kit, you want to make sure that it's dry, unopened, and unexpired. Because we've been practicing with it, our Foley kits are open. So I'm going to remove this plastic and then pull it down as a little bit of a trash bin, just so I have something close to me and I don't accidentally contaminate in my trash can. I already have this truck placed here as a waterproof barrier, just so we don't ruin the sheets. I will then carefully open my box away from me. Making sure to only touch the 1-inch border. Then grab the corner of my sterile gloves and move them to the side so I can properly put them on. I'll then put on my sterile gloves carefully and then walk my fingers on this side. I put it in the wrong way. I'm having some difficulty here. Okay, I made it. I'm gonna put that side, grab from the middle, discard. Now my hands are sterile and I can touch anything in this box and it'll be okay. So I'm gonna start with my drape. You can use the fenestrated drape if you want for this, but I am not. So I'm gonna take it and airplane it down and then set up my box. Mr. Jones, are you allergic to any latex or iodine? Okay, Mr. Jones is allergic to iodine, so I would take this iodine solution here and I would discard. But I do not have any hydrogen peroxide in my kit, so I'm just gonna pretend that it's hydrogen peroxide. So I'm gonna take it here and dump it over my cotton balls. Discard it in my little trash. Fluff my cotton balls here. Take my lubricant and open and place some in my tray here. Recap it, discard. And then I'm gonna take my saline, not losing the cap because I need it still, and attach it to the port. And then taking the tip of the catheter, I'm going to place it in my lubricant, like so. And then, all right, Mr. Jones, I am going to cleanse and I'm going to touch you now. I'm not inserting anything yet, but I will let you know when I'm going to. So now I'm going to take my non-dominant hand and I'm going to grab the shaft of the penis, and my hand is not going to leave that for the rest of the procedure because it is now clean and not sterile. So grabbing the shaft and holding it, I'm going to take my cotton ball and clean in a circular motion, discard, and then down, discard, down, discard. They give you a lot of cotton balls, so you might as well use them. Cleanse and then discard. So now, Mr. Jones, I am going to insert your catheter. What I'm going to do here is I'm going to take the tip of it, making sure I'm not too contaminated. I'm going to insert the Foley catheter into the tip, and I want you to go ahead and take a deep breath for me and bear down. And I'm going to insert the catheter all the way to the Y port. After it is inserted all the way to the Y port, I am going to grab the tip with my clean hand, and I'm going to take my syringe and I'm going to just inflate my bubble here. After inflating my bubble, I'm going to pull until I feel the resistance, like so. After the resistance is met, it can no longer come out, so then I can remove my hands and it is now a clean procedure. I'm going to take out my syringe, discard. If my patient had legs, I would attach it with a leg strap, but my patient does not have legs. So then I'm going to secure it with a little bit of slack onto the side of the bed here, like so. And then I would ask Mr. Jones how he felt about the procedure and document it in the chart. And then for the sake of the video, I also have to do a Foley removal. So I would start and I would clean up my whole area first, take off my sterile gloves, put on clean gloves, and then re-sanitize. So my first step in that, I would take the urine bag off of the side of the bed and then open it and discard the urine into the toilet or whatever measure it would be. I would then unhook the leg strap, but again, you know, my patient doesn't have legs, so, you know, and I would let Mr. Jones know that I'm going to be doing the removal and that it might be a little uncomfortable, but it'll be over fast. I would then take my syringe here, place it onto the port, and let gravity do its work and let my saline run back into my syringe. There's about 10 milliliters in the syringe here. And you don't want to forcefully pull the saline out because then it can cause urethral trauma. So we're just gonna sit and let gravity do its thing here. We're at about 7 milliliters here. We're almost done. Okay, we are now at 10 milliliters. I would take my syringe off, place it in the proper area. I would let Mr. Jones know that I'm now going to remove his catheter and to take a deep breath for me, and I'm just going to pull it out and I'm going to coil it into my hand. After that, I'm going to take my gloves, wrap it in, and then dispose of the whole thing into the trash, perform hand hygiene, and that's it.